How is paralysis diagnosed? Your doctor will examine you and inquire about any injuries. You will discuss when you first became aware of the problem in the case of gradual paralysis. Your healthcare provider may order one or more of the following tests to learn more. X-rays show broken bones that could cause nerve injury. Imaging tests, such as a CT scan or MRI, check for signs of stroke or brain injury or spinal cord injury. A whole body imaging scan shows bones, muscles and tissues. Myelogram checks for spinal cord and nerve injuries. Electromyogram, EMG, tests the electrical activity of nerves and muscles. Spinal tap, lumbar puncture, tests spinal fluid for infection, inflammation and disorders like multiple sclerosis, MS. What are the complications of paralysis? Other bodily functions, such as breathing and heart rate, can be affected by paralysis. Other body systems in the affected area may also be affected by the condition. You may be at risk for the following conditions depending on the type of paralysis you have: difficulty breathing, coughing and risk for pneumonia, urinary incontinence and loss of bowel control, pressure injuries, bed sores, and sepsis, blood clots and deep vein thrombosis, DVT, speech or swallowing problems, dysphagia, depression and anxiety, erectile dysfunction and sexual problems. How is paralysis managed or treated? There is no treatment for permanent paralysis. The spinal cord is incapable of self-healing. Temporary paralysis, such as Bell's palsy, usually resolves on its own. Physical, occupational, and speech therapy can help people with paralysis by providing exercises, adaptive, and assistive devices. These rehabilitation services can assist people with various types of paralysis in living independently and enjoying a higher quality of life. Other treatment is dependent on the cause of your paralysis and how it affects you. Your doctor may recommend rehabilitation in addition to adaptive equipment that allows you to feed yourself or drive, assistive equipment, such as wheelchairs, scooters, crutches and canes, orthotic/prosthetic devices, such as braces, voice-activated technology for computers, lighting systems and phones. How can I prevent paralysis? Spinal injuries are the most common cause of paralysis. You can reduce your chances of spinal injury by doing the following. Wear your seatbelt at all times. Check that children are properly using car seats or booster seats. Before diving, check the water depths. Don't drive while under the influence or ride with an impaired driver. When participating in sports or activities, take precautions. Wear a helmet, for example, when participating in sports. In gymnastics, use a spotter and cushioning mats as needed. Never move anyone who has suffered a head, neck, or spine injury. Paralysis is a life-altering illness. Even temporary paralysis can have an impact on your ability to do the things you enjoy. When paralysis strikes unexpectedly, it can be difficult to adjust to major changes in your way of life. Your healthcare provider can help you choose from the many rehabilitation and mental health services available. Many people with paralysis live active lives thanks to mobility devices and the support of family and friends.